If you're a new mom or preparing for motherhood, you've probably been told that breastfeeding is natural and instinctive. While that's true, the reality is that breastfeeding doesn't always come easily. In fact, many mothers experience challenges during the first few weeks or even months. We're going to talk about some of the most common breastfeeding problems and, most importantly, how to solve them. Latching problems. One of the very first hurdles new moms face is latching problems. A poor latch can lead to nipple pain, cracked skin, and even low milk transfer, which means your baby may not be getting enough to eat. Signs of a poor latch include you hear clicking sounds while the baby nurses. Your nipples look flattened, pinched, or misshapen after feeding. Feedings are painful, or the baby seems unsatisfied afterward. Make sure your baby's mouth covers both the nipple and a large portion of the areola. The chin should touch your breast, and the baby's nose should be clear. Try different breastfeeding positions: cradle hold, football hold, tucking the baby under your arm like a football, or side lying. Sometimes a slight adjustment makes all the difference. Let's talk about sore or cracked nipples, another very common challenge. During the first week or two, some tenderness is normal, but ongoing pain is usually a sign of an issue. Causes include shallow latch, feeding in awkward positions. Thrush. Thrush is a yeast infection that can affect both mother and baby. Solutions: sore or cracked nipples. Start by correcting the latch, since that's often the root cause. After each feeding, hand express a few drops of breast milk and rub it gently on your nipples. Breast milk has antibacterial and healing properties. Allow nipples to air dry. Avoid harsh soaps or alcohol-based wipes. Use a medical-grade lanolin cream to keep skin moist and protected. If cracks are severe, nipple shields may help temporarily, but use them under professional guidance. Engorgement. Around day 3 to 5 postpartum, when milk comes in, many moms experience engorgement, breasts that are overly full, firm, and swollen. This can be very uncomfortable and can even make it harder for the baby to latch. Solutions: breastfeed frequently, ideally every 2 to 3 hours, even during the night. Massage your breasts gently before feeding to help milk flow. Apply a warm compress before feeding to soften the breast, and a cold compress afterward to reduce swelling. If your baby struggles to latch, hand express or pump a small amount first to soften the areola. Engorgement usually eases as your supply regulates, but frequent and effective feeding is key. Blocked ducts and mastitis. Sometimes, milk flow can get blocked, leading to plugged ducts. If untreated, these can develop into mastitis, which is a painful breast infection. Symptoms of mastitis include hard, painful lumps in the breast, redness or warmth over the area, fever, chills, and flu-like symptoms. Solutions include continue breastfeeding on the affected side. Frequent milk removal is the best treatment. Massage the lump toward the nipple during feeding. Apply warm compresses before nursing to encourage drainage. Stay hydrated and rest as much as possible. If you develop a fever or symptoms worsen, seek medical attention immediately. Antibiotics may be required, and early treatment prevents complications. A very common concern is low milk supply. Sometimes moms worry unnecessarily, since babies feed frequently in the beginning, but in some cases, supply really is low. Causes include infrequent nursing, supplementing with formula too early, stress, dehydration, or certain medications. Solutions: nurse on demand, not by the clock. Babies should feed 8 to 12 times in 24 hours. Make sure the breast is emptied each time, since emptying stimulates production. Practice skin-to-skin contact with your baby. It helps trigger milk-making hormones. Stay well hydrated and eat a nutritious diet. Oats, fenugreek, and other galactagogues are believed to support milk production. Pumping between feeds can also encourage supply. Oversupply and fast letdown. On the flip side, some moms struggle with oversupply or a very strong letdown reflex. Milk may spray out forcefully, causing the baby to choke, cough, or pull away. Solutions: oversupply and fast letdown is try a reclined or laid back position so gravity slows milk flow. Express a small amount of milk before feeding to reduce the initial pressure. Offer one breast per feeding and switch only if the baby is still hungry. Burp your baby frequently, since swallowing air is common when milk flows too fast. Thrush and other challenges. Thrush is a yeast infection that can cause sharp nipple pain and white patches in your baby's mouth. Solutions for thrush. Both mother and baby may need antifungal treatment prescribed by a doctor. Wash hands frequently and sterilize pacifiers or bottle nipples. Keep breasts dry and change nursing pads often.